Hello guys, welcome all of you to today's PHARMCAST. Today also we'll discuss 5 drugs of choice, 1 monoclonal antibody, and a few questions asked by you guys yesterday. So let us begin with our drugs of choice today. So we are cruising through alphabet P currently, right? So the first disorder for today is Paget's disease. Now guys, remember Paget's disease, as you know, here also the drugs of choice are bisphosphonates, but with respect to osteoporosis, which I said yesterday, we prefer oral bisphosphonates like alendronate in osteoporosis. But in Paget's disease, we prefer intravenous bisphosphonate like zoledronate, right? So if I look at the uses of bisphosphonates, one side we have osteoporosis, where we prefer oral alendronate or risedronate. Whereas in case of Paget's disease and hypercalcemia of malignancy, we prefer intravenous bisphosphonates like zoledronate, right? And an important side effect of bisphosphonates, guys, is osteonecrosis of jaw. And remember, osteonecrosis of jaw is more common with intravenous bisphosphonates. Moving on to next disorder, guys, pancreatic cancer. Now remember, single best drug of choice for pancreatic cancer is gemcitabine, right? Gemcitabine is the drug of choice in pancreatic cancer. And in case of resistant cases, we can use FOLFIRINOX. FOLFIRINOX as a regimen, where we use folinic acid, 5-fluorouracil, irinotecan, and oxaliplatin. It's called as FOLFIRINOX. It is reserved for treatment of resistant pancreatic cancer. But single best drug of choice is gemcitabine. Next disorder, guys, paralytic ileus, right? Like post-operative paralytic ileus. So, guys, paralytic ileus, the drug of choice is beta-nicol. Paralytic ileus, drug of choice is beta-nicol, and beta-nicol is a cholinergic drug, right? So it will increase contraction of gastrointestinal tract and your intestine, right, by acting upon the M3 receptors. And an alternative to beta-nicol is neostigmine. Can also be used, but the preferred drug is beta-nicol. And now coming to the last disorder for today, it is PNH or paroxysmal nocturnal hemoglobinuria, right? For PNH, there are not many drugs, but a new drug was approved many years back, and that drug is called as eculizumab, right? So eculizumab is an anti-complement 5 monoclonal antibody approved for treatment of PNH or paroxysmal nocturnal hemoglobinuria, and in fact, eculizumab is the drug of choice as well in PNH, right? So that's our first section where we discuss the 5 drugs of choice for today. And let us move on to the second section, guys, where I discuss 1 monoclonal antibodies, right? So today the monoclonal antibody that I'm going to discuss is quite commonly used nowadays, and it is an anti-TNF, right? Tumor necrosis factor alpha, anti-TNF alpha monoclonal antibody called as Infliximab. So Infliximab is quite a commonly used drug nowadays for inflammatory disorders. Why inflammatory disorders? Because what is TNF alpha? It is an inflammatory mediator, right? So what are the inflammatory disorders where TNF alpha inhibitor Infliximab is used? So one is related to your joint disorder, rheumatoid arthritis it is used, right? Second, it is used in psoriasis like plaque psoriasis, even psoriatic arthritis it can be used. Third, it is used in inflammatory bowel disease like ulcerative colitis or Crohn's disease. And fourth, it is also used in ankylosing spondylitis. So these are the uses of Infliximab. Now coming to the side effect, see guys, one side effect that would be seen, by blocking TNF alpha, you'll be down regulating the lymphocytes, which means your immune system goes down. So with these drugs, there is always a risk of infection, right? The risk of infection always stays. Second, with these drugs, there is always a risk of secondary cancer that can be seen because of down regulation of the lymphocytes, and most commonly which is seen is melanoma is quite commonly seen when these drugs are used. And that is the reason why you should not combine a drug like Infliximab to any other class of drug which also down regulates the immune system, right? Because there would be a double blow to the immune system. Contraindication, remember Infliximab, there are 2 absolute contraindications. One is heart failure, because Infliximab is implicated in heart failure. It can cause heart failure. So patients of heart failure never use Infliximab. And Second is patients with hepatitis B infection, right? It worsens when infliximab is used. So 2 contraindications, hepatitis B as well as heart failure, you need to remember. Alright guys, so that's all in this section of monoclonal antibody that we had to discuss. Now let's move on to the doubts you guys have asked for today. Alright guys, so Raghavendra S has asked, sir, with 1 month left for the INICET exam, how to focus on the revision of INICET? So Raghavendra, yes, I have already told you this thing earlier. It depends upon what is your aim, right? Are you preparing only for INICET? Because see, I have come across students who prepare only for PGI or only for AIMS. You might be surprised, but yes, there are such students, some students like that. Though they are not very much, that there are very few students who focus only for their aim is only to get into a central institute exam, right? So if your aim is like that, then your preparation strategies should be directed totally against INICET, right? So in this 1 month, you should be able to revise your entire course, plus at least, because see, in 1 month you cannot do multiple revisions. So I don't know if you have started revision already or not, but at least 1 revision you should be able to do, and along with that, try to practice questions, the previous year questions of AIMS as well as PGI, right? So try to practice last 5 years AIMS and PGI questions, because in your INICET there would be single best response questions as well as multiple response questions. So practicing PGI questions will also be helpful, I think, like that. Plus do focus on images, because I guess there would be a lot of images in your exams, right? These are changing times. Alright, coming to the next doubt, Dr. Swati has asked, sir, during revision of pharma notes, if I want to revise according to important topics for NEET, then what should be the sequence of topics? Is it the same as you discussed in the NEET 2020 solution video? Yeah, so Dr. Swati is same. It has not changed. See, if you look at the antimicrobial topic, right? Antimicrobial is a very huge and a vast topic. So maximum number of questions are always from antimicrobials, followed by a second spot is for CNS, central nervous system, because it's also a vast topic. So these 2 topics, a lot of questions are asked. And then for other topics is variable. For example, sometimes they'll ask you 3 questions from autonomic nervous system. Another time they'll ask you not even 1 question, right? Sometimes they'll ask you 3 questions from blood, sometimes 0 question from blood. So for other topics, what I have seen is the number of questions being asked, they're always variable, right? So they might ask you from any topic, but I have seen what is constant in the exam papers are these 2 topics, antimicrobials and CNS, where your focus should be more. I mean, you should begin with revision of these topics, right? So that and it also, right, what happens is it also works on your favor, because since in the beginning you'll be able to finish the tougher and the voluminous subjects, so your confidence will also be high. So begin like that, Dr. Swati. Alright, coming to the next doubt, which has been asked by Ankush Singh, and he is asking, sir, I have not done many MCQs since start of my preparation, but is going good as theory is concerned. Now time is less, what should I focus? See, Ankush, you might learn as much theory as you want, right? But you know that your exam is gonna be MCQ based, questions would be asked, and you need to learn the art of solving an MCQ. See, solving an MCQ is not just about having knowledge of a topic and going and solving the question. No, it is an art that you need to develop constantly by practicing MCQs, by giving your subject-wise test, by giving your grand test, right? Because see, for many questions, you would not know the answer straightforward. I don't know the answer, is A, B, C or D, but looking at the question, by comparing the option, I can rule out option A and C. Now I'm in a fix between option B and D, and I have to choose one, right? So I have to go with my hunch, my gut feeling, by comparing the options with the questions. So these sort of things, they develop while you continuously keep on practicing routinely a lot of MCQs. And second benefit which I have seen, right, I have seen it myself, that suppose I study a topic, right, and I study a few points, then I solve an MCQ and I mark that MCQ as correct, and that one point which was the right answer, it sticks to my brain forever, something like that. Are you getting my point, where I'm getting it? So solving MCQs, right, of those topics which you have studied, they also help you to retain the content. Are you getting my point? So solving MCQs is very important. Now, see, now that you have not solved any, so there is no point in, getting depressed about it, right? This is not yet late. You can still begin now solving MCQs and make solving MCQ as a routine part of your life, like say 2 to 3 hours a day, and don't solve continuously 2 to 3 hours. Suppose you studied for 2 to 3 hours, your theory part, then solve MCQ for 1 hour, then study for 2 to 3 hours, solve MCQ for 1 hour, then study for 2 to 3 hours, then at last end your day with another. So try to segregate your study hours, right? Don't try to do anything bolus, because bolus study, what it does is it creates a sense of boredom, and your productivity does not increase. So while you keep on shuffling between questions and your notes or anything, then it becomes interesting a lot more, right? So Ankush, think you can do that. And Ankush is also asking, sir, should I cut down my sleep for extra time to study? See, Ankush, that's not going to work. I mean, it's just like you're asking, should I stop taking some oxygen? Right? You need oxygen, you need sleep. Just as you need oxygen, you need sleep to have a healthy mind, to have attention. Because see, only studying is not important. While you are studying, you need to have your 100% focus. You need to retain things. You need things to go back into your permanent memory. And when this physiological change happens, when the information transforms into permanent memory, that is in the sleep, right? So you need to sleep, guys. So don't try to cut down on your sleep or eating or whatever it is, right? All right, guys. Sheetal Meshram is asking the same thing again. Sir, I'm going to start pharmacology revision from tomorrow. Is there any specific order in which I should read your notes? Sheetal Meshram, if you are asking me, see, previous question was asked by Dr. Swati, I guess. She asked me that which one are more important, right? So I told you more important are antimicrobials and central nervous system. But if you ask me an order for revision, then I would say first revise general pharmacology, then autonomic nervous system, these two topics, then you can move on to any other. So this is what I'm saying, keeping in mind while you want to understand a subject, because G Pharma and autonomic nervous system is your gateway to systemic pharmacology. But if you have a great hold over G Pharma and ANS, you can go to antimicrobial, CNS, any topic, right? But if you want to make a sequence of events, right, how things unfold in pharmacology, then first you must go to G Pharma, then ANS, and after that you can jump to any topic you want, right? I guess so. Another doubt by Dr. Swati is, sir, maintenance of PDA. What is the drug of choice? I told you yesterday it is misoprostol, not alprostadil. Alprostadil can also be used, but drug of choice is misoprostol. Alright, next doubt has been asked by Ritvik Patnaik, has asked, so today in Marrow, image discussion videos are uploaded. How to utilize that, especially your video? See, in pharmacology, I would say images are not that routinely asked. I mean, it would be once in 2 to 3 years they will give some image, and all those things I discuss. I mean, how these images look like. The only images which are more important in pharma are the graphs of DRC, dose response curves. They are frequently asked. Every second or third year they do ask you. So go through DRC, dose response curve, and just go through the IBQs which I have discussed, and that is related to your theory. For example, if you look at bleomycin, it causes flagellate dermatitis. So I've covered that also. So that was recently asked in AM6M as well. So go through them and just take it as a way of revision, right? So don't take it as an extra burden, because whatever images will be discussed, you have already studied about those images in the normal video lectures, right? So now it is not that it is something new. No, it is the same thing, but it is just a segregated version of just images. So take it as a part of revision. So I would say how to utilize them judiciously is whenever you are tired, right? So you're revising, I'm tired now, and I cannot do some active study, right, revision. So what I'll do, I'll just relax a bit, I'll lie down, or I'll just relax on the couch, and I'll switch on these videos and watch them for half an hour or 1 hour, so that I would relax a bit, plus I'll gain some knowledge as well, right? So they will complement you, because I told you guys, images are very important, and images are more important for subjects like pathology, microbiology, medicine, radiology, right? So these are very important. These 4 subjects, they're very important as far as the images are concerned, and even surgery as well, right? Some images are asked. All right, moving on to the next question, guys. Azan Sheikh has asked, sir, I have dropped 2 years to get an MBBS seat, and now I'm a second-year student. There is always a subconscious thought, and also there is pressure from my family to get a PG seat in my first attempt to support my family financially. And this though leaves me depressed on a day-to-day basis. I'm not able to enjoy my student life. I always think of next exam and start to prepare ahead. See, Azan, I would bet most of the students, right, in our country, most of the students, most of us, we belong to middle class or lower middle class, and this is a kind of pressure that always remains. And even I was through similar kind of pressure because right, there were a lot of loans, education loans, etc., and I knew that that was the burden that I had to shoulder for my parents, right? And one thing I have learned in life, that these pressures, right, these social pressures, these pressures, financial pressures, they bring the best out of you. They bring the best out of you. They do not allow you to be laid back in your attitude. They always keep you on your toes, that you need to prove. You need to prove nobody else. Don't get me wrong. Nobody else you need to prove. You need to prove yourself that you can do this, you can better than this, and you can pay back everything, right? Whatever your parents they have sacrificed, in a manner which will make them not only wealthy. Wealth is, temporary, but it will make them proud that yes, our son is doing something for us. So you'll get there. Azan's sake, believe me, these hardships that you're feeling now is gonna mold you, is gonna shape you for a better future. So take it as a challenge, right? Being depressed is normal. So it's not depression actually, but the thing is that you want to get there, right, sooner than later. But you know that everything happens with time. I mean, it cannot happen tomorrow or day after tomorrow. It will take its time, right? Your course, you have to finish your MBBS, then you get through the PG seat, and you'll get there. But one thing is, keep this hunger alive, right? Keep this fire in the belly burning, and you will see this fire in your belly will be the fuel that will take you where you have not even thought about, right? So, see, we all are ordinary people, right? We all are ordinary citizens. But one day we become extraordinary, and that is because of these pressures that they keep us pushing us ahead towards our goal. So don't take it as a depression, right? Take it as a fuel and keep it burning, keep it nurturing, so that it takes you ahead and in life, Azan, right? So don't worry about these. Madhulita Patnaik, so next doubt. Sir, I'm a second year student. I'm watching pharmacology, but I am not doing Q bank. What should I do? See, Madhulita Patnaik, if you're not doing Q bank, that's okay. I mean, it's not a big deal. But if you could solve at least some questions, right? You need not finish all the questions, but at least some questions, if you'll solve, what you'll get is you'll get a sense of satisfaction. That is one. That I'm able to apply the knowledge that I have earned, right? Second is, as I've said earlier, that when you solve questions, Q banks, what happens is, suppose you studied a topic, right? And then you solve questions, then you get a hang of how questions are asked from a topic. And then when you go to the next topic, next video or notes, whatever you study, then you can imagine actually while you're studying through it that how questions would be asked. So you need to develop the tendency of anticipation, that this is the topic, this is what I'm studying, and how MCQs would be asked from this. So that changes a little bit a way of how you study. Now that is not compulsory, Madhulita. If you are comfortable, you can go with it. Otherwise, it's perfectly okay not to solve questions at your stage, because you're just second year and you can enjoy your life, right? Live it to the fullest. But if you can do that, that would be okay. And so she's also asking, sir, can I go through Sakshi ma'am's videos, or is it too early? All my seniors appreciate her so much. See, Madhulita, you'll get time to go through Obs Gynae. You'll have time. But see, the way things are going now, by the time you will get out, there will be next exam. So you need to take it step by step. So currently, while you are going through your second year subjects, make sure that your second year subjects are foolproof, so that when you are in your final year exam, right, after that, when you prepare for the next exam, you don't waste too much time on pre-paraclinicals. And that's only going to happen only if it is rock solid at this level. Are you getting my point? So from here onwards, what you need to do, guys, is focus year by year. First year subject, second year subject, third year subjects, and make them rock solid, have rock solid notes, so that later on, you just need to go and revise those notes, and in shorter period of time, you'll be able to cover the first year and second year subjects, right? Shruti Gill has asked, sir, please guide me how to balance second year subjects with medicine surgery. Shruti, you need to little bit elaborate your question because I'm not able to understand. The context of this. Are you appearing for this NEET exam or are you preparing for the next NEET 2022 now, right? So if you give me a little bit elaboration on what is your exact problem, considering which exam you are appearing, then I would be able to help you, right? Because as of now, if I look at your question, I'm not able to make out, what is the actual problem? Second year subjects with medicine surgery, for what? If I look at now, then we are almost, couple of months away from the exam. So there is no time now to make any change to your strategy of preparation. Whatever strategy you had made, you need to stick to that. But if you are aiming for the next NEET exam, like 2022, when we'll be having the next NEET exam, right? If you're aiming for that, then there are different ways how people study. Some of them, they combine and they study system-wise, like so anatomy, physiology, pathology, pharmacology. They'll go system-wise, like they'll pick up GIT and they will cover up whole GIT in these, then go to medicine GIT, then go to surgery GIT. That is one way of studying. But remember, it is very productive, but it requires a hell lot of a commitment from your side. You cannot do it until unless you're too much committed. Again, for example, you study anatomy, then you leave in between for 1 month, then you study physiology. That's not going to work. So you need to have a chain of study of these subjects, a rigorous routine which you need to follow. Otherwise, I've already told you that how you need to study these second year, first year subjects, kill them when they're alive. So Shruti, you need to little bit explain to me that which year you are in now. Are you a second year or third year, or what is your target, right? So in today's Pharmcast, whenever I post it, Shruti, you please elaborate your exact problem, right? Then I'll be able to help you better. Alright guys, so that's all for today's Pharmcast, and if you guys have any such kind of doubts, queries, you can always let me know in the comment box. And guys, try to post these doubts in the the Pharmcast that I post in the YouTube channel, because that is where in the comment of that YouTube post I get all these doubts. Now if you directly message me your doubts, then there is always a risk that I might miss on your doubts, because the social media is kind of a flood nowadays. There is Twitter, there is Facebook, there is Instagram, there is page. So I get kind of confused sometimes with this social media. So if you can comment me in the YouTube channel, I will cover it, right? So that's all guys for today. Take care. Bye bye. This was Dr. Ranjan with you.